Well, a deep venous thrombosis will normally develop in the veins of the leg, in the deep veins. And the deep veins are the veins that run through the muscles of the leg. And then if a bit breaks off from that, that is an embolus. And an embolus is anything, one would be embolus, several would be emboli. So the condition is embolism. So embolism is anything moving through the lumen of a vein or an artery that has the potential to obstruct the lumen of that blood vessel or of a blood vessel. And here we're talking about deep venous thrombosis, so we're talking about the systemic venous system. So if a bit breaks off from a thrombus, it will travel in the flow of blood. It will go up through the venous system to the right side of the heart, and then it will be pumped to the lungs. But what I want to do now is look at that anatomy in a little more detail. So if we think about, first of all, the veins in the calf, it's basically two lots of veins here in the calf. These are the anterior and the posterior tibial veins. And these are the deep veins. There's a small saphenous vein and other superficial veins, but these are the deep veins. And the reason that they're called the deep veins is because they run through the muscle. So these veins are running through the muscle. They are underneath the muscle fascia. And this is good, it's important, because what this means physiologically is when the muscles contract, that's going to squeeze on these veins. As the muscles shorten, they're going to squeeze on these veins, greatly increasing the pressure inside the veins, and that basically squirts the blood back up towards the inferior vena cava and the systemic circulation. So here we've got the anterior and posterior tibial veins, as you would expect, in front and behind the tibia. Then these join together at about the level of the knee, and at this level they're called the popliteal. So that's the popliteal vein. So they've just joined into one now in any one leg. Then other small vessels join this, but it carries on getting bigger. And when it's going past the femur, it's called the femoral vein. So the popliteal vein becomes the femoral vein. And it carries on getting bigger, and it becomes the external iliac vein. The external iliac vein. The internal iliac joins about here as well. But the main one carrying the blood back from the leg is the external iliac. And this carries on into the common iliac vein. And again, we see things are getting wider as we go along. And of course, there's one from the other leg as well, where the anatomical arrangement is essentially the same. And then the common iliac veins, so this is the common iliac vein here, after the internal iliac vein has joined the external iliac vein there, then this becomes the inferior vena cava, again getting much wider. So what this means is, if there's a blood clot here, if there's a thrombosis there, and emboli break off from that, then as the emboli travel through the venous flow, because the veins of course are draining blood in this direction like this, up towards the inferior vena cava to go back to the heart, what it means is, as we go through the anterior and posterior tibial veins, the popliteal vein, the femoral vein, the external iliac vein, the inferior vena cava, all the way up, the lumen is getting wider as the emboli travels up in the normal venous return. So because it's getting wider all the way, there's nothing to stop it. It's not going to lodge in a vessel there, because as we go up, everything's getting wider, the lumen's getting wider. So the emboli can pass easily through that area. But then as we go further up, what's going to happen of course, is the inferior vena cava. Is going to pass up through the abdominal cavity. So it's passing up through the abdominal cavity, up into the thoracic cavity as it goes through the diaphragm. And what happens is the inferior vena cava is going to drain into the right atrium, draining into the right atrium. This is going up the right side of the body into the right atrium. And of course, it's going up this right-hand side of the body in the inferior vena cava, whether it's come from the right leg or the left leg. That doesn't make any difference. The inferior vena cava is the common pathway for venous return. So this is going to go into the right atrium. So here we have the right atrium here. So this is the side of the heart here, like this. That's going into the right atrium. And of course there's the superior vena cava going into the right atrium also. So here we have the right atrium, and between the atria and the ventricles we're going to have the atrioventricular valve, which is just here. This atrioventricular valve on the right side is going to be the tricuspid valve. So this down here is going to be the ventricle. So this is the atrial wall here and the right ventricular wall. And of course this is all composed of myocardium. This is atrial myocardium, and this will be right ventricular myocardium here. Now, what we also have, of course, here is the entrance to the pulmonary artery. So this is the pulmonary artery here, bringing blood out. So the right atria will carry on there like that. This would be the continuation of the atrial myocardium. There we are. The cardiac septum would be in this area here, dividing the two sides of the heart. So this will all be cardiac. This would be cardiac septum here. And of course we would have the left side of the heart here. This aortic valve here would be the entrance to the aorta. And then here we would have the mitral valve, but we're not going to draw that at the moment because we're thinking about the right side of the heart. So what's going to happen with these emboli that are passing through increasingly large lumens of vessels? It's going to go up the inferior vena cava, and the inferior vena cava is going to join here like this. So that's the continuation of that. So the emboli are going to carry on passing up here, and they're going to go into the right atrium here. And again, no problem because everything's getting bigger. Then when the right atrium contracts, the blood's going to go through into the right ventricle. And again, no problem because we're in a relatively large area here. And when this contracts, it's going to be ejected into the pulmonary artery. And what we have here is the main pulmonary arterial trunk, taking blood from the heart to the lungs, guarded by the pulmonary arterial valve, or sometimes called the pulmonary arterial semilunar valve. Now what happens next depends on the size of the embolism that's come from the thrombus in the leg. If it's a very big emboli, then it can block off the pulmonary artery, causing absolutely massive pulmonary emboli, and that would be potentially an instant death or very sudden death situation. But if not, what happens is the pulmonary artery will come from the right ventricle, and it fairly quickly divides into two, one going to each lung, the right and the left pulmonary artery. So let's follow the course of, doesn't matter, we'll follow the course of the right pulmonary artery. So here we have the right main pulmonary artery. This will be the left main pulmonary artery. This is the main pulmonary trunk here. And this is going to divide into interlobar arteries and then into lobar arteries. And these are going to divide down into smaller segmental arteries. And we're going to get this arterial tree, this fractile tree. So the pulmonary trunk divides into the right and left main pulmonary artery, interlobar arteries, lobar arteries taking blood to the lobes of the right lung. Remember, there's 3 lobes in the right lung. Then into smaller segmental arteries, and then eventually into smaller subsegmental arteries. So the segmental arteries taking blood to the lobe segments are going to divide into subsegmental arteries. And what will happen here, as you see here, as an embolus comes up here, it's going to now start going into progressively smaller vessels. So if it's that size, it will lodge at that level there, maybe at the level of a lobar artery. If it's a smaller one, it will pass through there and block off at the level of, say, a segmental artery, or a smaller one affecting a subsegmental artery. So we can see that smaller emboli are going to affect a much smaller area of the lung. But of course there can be multiple emboli, so we could end up with emboli lodging in the pulmonary circulation at different areas. So this is now in the pulmonary arterial system, so these are now pulmonary emboli. So that's basically the course that it takes up through the body, very often starting in the lower veins of the leg, the anterior posterior tibial, going up the popliteal, femoral, iliac, inferior vena cava, going back to the right atrium, right ventricle, main pulmonary artery. And what happens to it, depending on the size, it will lodge in a part of the pulmonary arterial system. And now it is most definitely a pulmonary embolism. So deep venous thrombosis gives rise to pulmonary embolization in the condition of venothromboembolism.